IMedis is an Israeli startup company developing DualiQ, a revolutionary medical innovation that promotes early detection of cancer and other life-threatening diseases using AI technology. Aviel Blumenfeld is the CEO and co-founder of IMedis and has an extensive multidisciplinary experience in the medical device industry. How will AI technology be integrated into the medical workflow, and are radiologists going to be replaced by it? And by the way, hello and welcome to you.
Hi, thank you for having me. So first of all, I think that a few years ago, many people thought that AI is going to replace radiologists. But I think that everyone that knows radiologists knows that they are superhumans, right? They are looking at CT scans, for example, being able to detect hundreds of different findings, taking complex diagnostic decisions in a matter of minutes. So they're not going to be replaced by AI, I can assure you. But I think that there is a say now, which I find it very accurate, that radiologists who use AI will replace those that don't use AI. So, and there are very good use cases for AI already in the field, including automation of repetitive tasks such as measurement, streamlining clinical workflows, triaging acute findings, and many more other use cases.
Wow, excellent. So that's good to know for all of the professionals that are worried about their jobs. What makes IMedis so unique in its technology and its value proposition?
Thank you for this question. I think that when we started the journey, we realized that we want to solve a real problem for radiologists. And we learned that for them, missing actionable findings that are visible in the images, even though they are not part of the clinical question, this is a problem we would love to solve. And we thought how AI is being used in every aspect of our life. And most of us found it over here in our cell phones when we type text messages. And we decide what to type, right? But whenever there is a typo, the AI come in with autocorrection, and we love it. So this is exactly our perspective when we developed DualiQ. We combine image analysis and text analysis. First, we analyze the images to detect those life-threatening findings. And in addition, we are analyzing the text radiologists are writing in their diagnostic report. And whenever we detect a significant miss, then we intervene into the workflow.
That is an excellent comparison.
Thank you for that. And we saw in the video that we already validated clinically DualiQ and saw at UC San Diego that we are able to increase the detection rate by 13%. And I think it is amazing. So for patients, we really improve their health outcomes. We augment radiologists, not threatening them, allow the hospitals to provide quality-based healthcare, which is very important these days, and for the health system, really promoting early diagnosis and reducing the treatment expenditure due to the late treatment today.
Thank you. When did you first understand the value of this solution?
It's quite interesting. I think that it was not too far from here, and when we started to work at Tel Aviv Medical Center at Ichilov Hospital, immediately after we launched a pilot, we did a technical test, right, to make sure connectivity is working. So we asked, just throw on us 150 cases, let's see if everything goes smoothly. Everything went smoothly, but the team asked us, hey, are there any results out of this trial, out of this connectivity test? So we sent them the results, and we were amazed to receive a phone call the day after, letting us know that they decided to call back 8 patients that need additional follow-up due to our results. I was very proud for making this change for these patients.
Extremely impressive.
Thank you.
Now tell us, what's the next step for the IMedis?
Well, we are constantly growing and entering into the commercial phase of the company. And as part of this growth, we are fundraising as well. We are currently fundraising through a platform called Exit Valley, which allow private investors to join as shareholders in private companies to be part of our success and our journey. And we don't stop with DualiQ. We see a lot of value by offering a comprehensive quality management platform for radiology departments, covering various critical failure points throughout the workflow, and even not to stop there, to continue and to enter into other medical fields.
Well, we wish you luck.
Thank you very much.
Thank you so much. All right, well, that is it for IMedis Life-Saving Technologies Conference. We've looked today into the fascinating future of medicine, and we've heard from top experts throughout Israel and Europe, and from leading Israeli technology companies. IMedis is all about access and connections, exposing Israeli tech to leaders in governments and companies around the world to promote business whose goal is innovation. The exposure right here at this conference is a first step. The next step, maybe? Delegations and real-world business connections are next. We want to thank you all for taking part, and we hope that this is just the start of doing business together, making technology accessible to all, and improving the lives of people across the world. That's it for now. I'm Shanna Fold. Thanks so much for joining with us.